So we've talked about how correlation does not equal causation, but there is a method we could use to determine causation. So the experimental method is where an investigator is going to deliberately manipulate something, which is going to be called the independent variable, and observe the effect on another, on behavior or mental processes in psychology, but in just general science. They will observe what happens when they manipulate that independent variable, and that result or that effect is going to be your dependent variable. This is the only method that involves cause and effect. Okay? So this is an interesting fact to prove that stomach ulcers were caused by bacteria and not stress, because for a long time they thought stomach ulcers were caused by stress, and they are aggravated by stress. But most stomach ulcers are actually caused by bacteria. So a doctor or a researcher, Barry Marshall, drank the bacteria that he thought caused ulcers, gave himself an ulcer, and then won the Nobel Prize in medicine for that. I don't recommend that as a way to get the Nobel Prize. All right, so everything starts with a hypothesis. A hypothesis is basically an educated guess. And so an example will be visualization. That's like where you close your eyes and visualize something happening. Will increase the number of words that an individual recall off a list. In other words, so if I give you a list of words, if you close your eyes and visualize those words, you'll remember more of them. That's the hypothesis. The null hypothesis is, null means no. And so basically the null hypothesis says that visualization will have no effect. Okay. So anytime you see null hypothesis, that just means that whatever you are studying had no effect, or you think it will have no effect, because that's the hypothesis. Remember from your other science classes that a hypothesis is a researched guess or an educated guess. Now, every experiment, so you take a hypothesis, right? And then you're going to conduct an experiment on that hypothesis. And every experiment needs to include an independent variable. What will be in the cause and effect relationship, the cause. The independent variable is what you as the researcher are manipulating in the experiment. Hopefully, the independent variable brings about a change, but if it doesn't, then that's valuable too, because you know that that particular variable has no effect on what you're trying to change. So that's good information as well. If there is a drug in the experiment, the drug is almost always the independent variable, okay? So if we're talking about the effectiveness of a certain drug, the drug is almost always going to be your independent variable, because that's what you're offering, hoping to affect change. That is what you are giving them in order to cause an effect of getting better, right? So the independent variable is your cause. The dependent variable is your effect. So whatever you're measuring in the experiment is the dependent variable is dependent on the independent variable. The dependent variable would be the effect of a drug or a treatment.
You can't turn on the news these days without finding out that something else is bad for you. Cell phones will give you cancer. Artificial sweeteners will kill you. Eating at night will make you fat. Video games will make you violent. Reading in the dark will make you blind. It's a wonder the species hasn't died out already. But in almost none of these cases has anyone ever proven that something causes something else. To do that, you need a specific and certain type of study. You need a randomized controlled trial, or RCT. But RCTs are the hardest and often most expensive kind of studies to do. Nonetheless, they are necessary to prove a causal link between one thing and another, and they're the topic of this week's Healthcare Triage. I've written a number of books about medical myths, and the one that still causes me the most heartache and gets me the most hate tweets is the myth that sugar makes kids hyper. I can already hear some of you screaming, "You now think I'm crazy," or that I'm in the pocket of big sugar. You've seen it for yourself. You or your kid gets hyper when he or she eats sugar. But what you're describing isn't a study, it's an anecdote. I don't care that you've seen it lots of times. The plural of anecdote is not data. So what do we need to do to prove that sugar makes kids hyper? First, we might get a bunch of kids together, give them candy. We'd see if they acted hyper after they ate it. Let's say they did. Would that prove anything? No! They might have been hyper already, or maybe they all got more and more tired over the hours and hours we forced them to eat candy, and that's what made them hyper. You can't tell if it was the sugar or if it was something else unrelated to that led to their hyper behavior. So another thing we could do is take a different set of kids and not give them candy. Then we could compare their behavior to the kids who got candy. And as long as we kept everything else the same, like the time of day, we can be more sure that it's the candy that had an effect. The kids that didn't get the candy comprise what's called a control group, and this study design would be a controlled trial. But there's another potential problem. Maybe the kids in the first group were all boys. Maybe the second group was all girls. And that might mean that the differences we see might not be because of the candy, but because girls are made of sugar and spice and boys are made of snails and puppy dogs' tails. To overcome this type of bias, we can't let the parents make the decision of which kids go in each group. We have to make it random. If we take all the kids and randomly assign them to candy or no candy, then we can be even more sure that whatever effect we saw was because of the sugar. This is a randomized controlled trial. It's still not perfect though. Maybe the kids who got the candy loved the sweet, sweet taste of sugar so much that they acted differently just out of happiness. Maybe the kids who got no candy were so pissed that they just sat and sulked. Then the difference wouldn't be because of the sugar, it would just be because of the taste. Or maybe the parents who saw their kids get sugar just believed that their kids were more hyper. They may want to prove me wrong so badly that they convinced themselves that they saw hyperactivity even when it wasn't there. To overcome these biases, we have to prevent the kids, who are the subjects, from knowing whether they are in the sugar or no sugar group. We also have to prevent the parents, or the observers, from knowing that too. So first we have to come up with a placebo, or fake treatment. Say, sugar-free candy. Blech. But if the kids can't tell which is which, then we've blinded them to which group they're in. If the observers also don't know which group the kids are in, this would be a double-blinded, randomized, placebo-controlled trial. That's a mouthful, but it's pretty much the most robust study design you can have. This is a subtle but incredibly important thing. Other study designs can prove an association or a correlation, but as Hank and John and anyone who thinks scientifically like to say, correlation is not causation. We may know that television viewing is correlated with attention deficit hyperactivity disorder, but is that because TV causes ADHD, or is it because kids with ADHD like to watch more TV? Or is something else to blame? Could it be that parents of kids with ADHD are more permissive of TV watching? We just don't know. Only a randomized controlled trial can prove causality. Now, you can't have a randomized controlled trial for everything. We're never going to have one that proves that breastfeeding is superior to bottle feeding because it wouldn't be ethical to force women to do one or the other. We'll never have a randomized controlled trial of smoking and cancer because it wouldn't be right to force people to smoke. We're too sure it's probably really bad for you. That, by the way, is how the tobacco companies get away with saying that it's never been proven that smoking causes cancer, because there's never been a randomized controlled trial. And there never will be. Back to sugar and kids. There have been 12, count them, 12 randomized controlled trials of sugar and hyperactive behavior in kids. They've been published in places like the New England Journal of Medicine. That is likely more studies than for any drug you've ever taken. These studies looked at sugar differences in overall diet and found no difference. They looked at kids getting sugar in a huge bolus, say from gorging candy bars, and found no difference. They've even studied kids whose parents swear that they are sensitive to sugar and found no difference. And in the best study of them all, they gave a whole bunch of kids a sugar-free beverage and then lied to a random half of the parents and told them that their kids got sugar. Those parents rated their children as more hyperactive. It is not the sugar. Parents just believe it is. This myth is entirely in their heads. So there are plenty of good reasons kids might act hyper when they get sugar. Often it's at a birthday party, or on a holiday, or on Halloween. Moreover, some parents are so crazy about sugar that their kids never get it. So when they do, those kids are really, really excited and hyper. But that's not because of the sugar, it's because of the parenting. Sugar doesn't make kids hyper. We know that because we have randomized controlled trials to prove it. Case closed. And next time someone tells you that they read something causes some other bad outcome, make sure you ask them if the study was a randomized controlled trial. I can almost guarantee you it wasn't. Before we go, please note that there are plenty of other reasons not to give kids too much sugar. The pediatrician in me feels compelled to say that.
So as we watched that video, we learned some valuable vocabulary. First of all, population. So a population is the group from which you want your participants to come from. So population could be kids from age 3 to 5, maybe in this experiment, or students of Moz. That's your population. Your experimental group is going to be exposed to the independent variable. In other words, in that particular example, they're the ones that got the real candy. Your control group will not be exposed to the independent variable. In other words, they will be given a placebo, or they will not be given the treatment. Okay? Now, the other thing about these experiments is that guy said there were 12 random double-blind studies done. 12. So they didn't just go off of one study. Somebody took that study and replicated it, and someone else replicated it, and all got similar results. Now, one of the things he talked about was confounding variables, but he didn't use that word. So the object of an experiment is to prove that A causes B. So to prove that sugar makes kids hyper. A confounding variable is anything that could cause a change in B that's not related to A. In other words, something that could cause a change in the kid's behavior that's not candy. Now, researchers do try to control these, but they can't always be controlled for, which is why it's sometimes difficult to get a clear causal link. Research do have to try and control them. The aim is to manipulate the independent variable and measure the dependent variable and control the confounding variables. Okay? So one of the ways in which you do that is by having researchers rate the kids' behaviors versus their parents, because parents are going to rate behaviors different. The other one was random, right? So the parents didn't know if their kids had sugar or not and had to rate their behavior. Okay, that eliminates the parental aspect. If you're wanting to prove that smoking causes heart issues, what are some confounding variables? Well, do they exercise? Do they not exercise? That's a confounding variable. Right? Do they have good genetics? So were their parents have heart disease or not? So these are some things that we try to, as researchers, mitigate. So we would want to get a sample of the population that all has a similar lifestyle or who has variable lifestyles. And then we could additionally look at the differences in lifestyle and smoking. But if you're just looking at smoking, it's important to get as many people who are the same in as many aspects in order to eliminate confounding variables. The other thing he talked about was random assignment. Once you have a random sample, randomly assigning them to two groups helps control for confounding variables. So if I take Moz students and I just pick 100 at random, I then am going to randomly split those into groups of 50. Okay? And then one group of 50 will be the experimental group that received the treatment. And then the other group of 50 would be a control group that doesn't receive the treatment or receives a placebo. So the other thing that's important is going in blind. Participants need to be randomly assigned to research groups and not told which group they're in. That was really important in the parental sugar study because as we saw, the parents who knew their kids were given sugar rated them as more hyper. So if you randomly assign them and then don't tell them which group they're in, then that makes the subject blind, the subject being the person on which you are studying. However, if you make sure that not only do the participants not know who has what, if they're getting the treatment or not, but also the researchers don't know. So in our candy example, if you divided up your random group into two groups, experimental and control, gave them each a placebo candy, and didn't tell them whether it was sugar or not sugar, and you didn't tell the researchers, that would be a double-blind study. Now, the placebo effect, experimental results caused by expectations alone. If you expect something to work, then it might actually work. Can sugar pills or saltwater injections be used? Injections have a more powerful effect because they can be effective in treating different problems. Almost 50% of US doctors prescribe placebos. You guys, placebos have a bad name. So placebos are like, well, in our candy experiment, it was like a lollipop with no sugar in it made to look like candy. So kids thought they were getting candy. Okay. So like a sugar-free lollipop. That's a placebo. But sometimes doctors can literally prescribe to you a pill full of sugar or salt or nothing and say, this is going to cure your depression. And because you believe it's going to cure your depression, it actually does. And there are so many studies on this that the placebo effect, they call it, is real. And it works because beliefs and thoughts are powerful enough to provide the same relief as some actual real treatments. So they actually show in brain scans that brains release natural painkillers after a placebo was injected. The color matters. Relaxing pill are green and blue, and energizing pills are red and yellow. So that matters. When giving a placebo, the more expensive, the more real it seems. If it's more expensive, it's better.
To treat people in great pain. Volunteers with severe knee arthritis were gathered from around the state and divided into groups. 2 groups would have a surgical procedure. The third would be given a placebo, fake surgery. They'd have a general anesthetic, be opened up, but wouldn't have any real procedure. They would merely think they had. I had to meet the surgeon.
It's very important for the patients not to know which treatment that they have. And they're always trying to look for clues. You know, they're always trying to get you to tell them. And the best way to avoid that, of course, is to not know as a doctor until the last minute which treatment they're going to have.
Each patient would receive a general anesthetic, but only 2 groups would have an actual procedure. Not even the surgical staff knew who was in each group until they were in the theatre.
I would open the envelope in the room and I would read it, but I wouldn't announce it out loud. And then I would show it to the nurses who were working with me, and I would show it to the anesthesiologist, and nobody would ever say which of the 3 treatments was revealed in the envelope. We had a very elaborate ruse, if you will. I would play a videotape on the TV of a real surgery. And while I was watching the TV, I would ask for instruments and pass things back and forth and carry on conversation as if it was what I would really have done if what was happening on the TV screen was actually going on during that surgery. So we would have water splashing, we would have instruments clanking, and we would do this for the same amount of time that the actual surgery on the videotape took place, so that a patient and their family couldn't watch the clock and say, oh, we were only in the operating room for 10 minutes, so it must have been a pretend surgery.
All this acting felt a bit weird to a doctor trained in standard surgical procedures.
In the big picture, always in the back of my mind, I was thinking, good gosh, here's a patient who we're pretending to do surgery on. We're not really doing surgery, and you know, I'm a physician and a healer after all, and is this kind of really, you know, the right thing to do? Or what have I gotten myself into?
It took 2 years for the study to be completed. Finally, it was time for Dr. Mosley to hear the truth from the patients themselves.
I I would say, if you think that the surgery helped your knee, I want you to give me a thumbs up. If you think the surgery didn't help your knee, I want you to give me a thumbs down. And if you're not sure or you're kind of neutral, just hold your hand flat. Twist your knee
The verdict? Success for every group, fake or genuine. Sham surgery had worked. The patients who had it were astonished.
The response ranged from, "You got to be kidding me," "I can't believe it," bewilderment, "There must be a mistake," because they all felt so strongly that something had happened to change what was going on inside their knee.
During your training, what were you taught about the placebo effect?
Nothing. I had no clue. I went from being a skeptic to a believer. I realized that we were really onto something. There are clearly cases where we do surgeries and it's as much or more the patient's feeling about the surgery that influences the result as the actual surgery itself.
Dr. Mosley had seen patients get better purely because of what was in their minds. The pain had gone. It seemed too good to be true, and it did all happen 7 years ago. I wanted to see one of the patients who'd been in great pain before having Dr. Mosley's surgery. I wanted to know whether the placebo effect could still hold.
When I first had that pain, before that, I couldn't do a lot of things I did, like going fishing or playing basketball or going dancing. And after that, I was able to do that.
He could. Woo. We could go dancing. He took me dancing, and he could dance all night.
Can you describe what the pain was like before the operation?
Terrible, awful. I didn't think that it could be any worse.
It's emotional. Why is it because you were in so much pain before?
Yes.
And what would you say it was that really cured you? Was it Dr. Mosley, or was it you and your mind?
That is kind of a intriguing question, because I got to credit Dr. Mosley for doing what he did. But it was my mind that cured the problem.